We sat down with Dr. Peter Steinmetz, Director of Undergraduate Bedside Ultrasound Teaching at McGill University and Chair of this year's World Congress of Ultrasound in Medical Education, to discuss the biggest challenges and important steps in developing an undergraduate point-of-care ultrasound curriculum. What were your biggest challenges in gaining the agreement of the Undergraduate Medical Education Department at McGill to make room for the inclusion of a 4-year PoCUS curriculum?
Well, the challenges had to do with, first of all, convincing the new curriculum implementation committee that teaching was essential for future clinicians, and number two, to find the time within the curriculum that was appropriate for teaching point-of-care ultrasound. Number three, to find the appropriate instructors and staff to teach the curriculum. And number four, to assure the infrastructure was in place in order to carry out the curriculum. So taking them one at a time, in order to convince the committee that point-of-care ultrasound was an essential component of a future clinician's clinical skills, we looked at the literature on teaching medical students point-of-care ultrasound and found that this was already done worldwide, so across Europe, Asia, and more in North America. This was already being done, teaching point-of-care ultrasound to medical students. So we knew it was being done. The next question was, were the students learning these skills, and at what point were they learning them? And the answer to that was that it was quite heterogeneous, the manner in which they were learning. So in other words, some schools were teaching them as a first year, some were teaching them as a fourth year, some of them were teaching ultrasound as an adjunct to the physical exam, some were teaching it as a way of learning anatomy. So quite a heterogeneous approach to the teaching of ultrasound. The next question was, are the students learning or acquiring the skills that are set forth? And the answer to that is uniformly yes. And so students are able to learn ultrasound and learn the skills necessary to practice point-of-care ultrasound. And then the very last question in terms of relevancy is, are students better clinicians when they use point-of-care ultrasound? And so those questions have sort of formed a pyramid. There was a lot of information on how much was being taught and when. There was a little bit less information on the skill acquisition of students. There was even less information on whether the students actually were better clinicians when they were taught. But there is information out there, including articles by Cobal showing that medical students are more accurate at diagnosing or identifying cardiac pathology when using a portable ultrasound as compared to cardiologists using physical exam alone, or DiCara from 2005 showing that medical students, when using ultrasound as an adjunct to their physical exam, were more accurate clinicians when compared to those same students using physical exam alone, or Muratev in 2013 showing that medical students using ultrasound were more accurate in the measuring the liver span when using ultrasound than as compared to internal medicine staff using physical exam alone. And then lastly, something we are also about to publish, where we've shown that medical students are more accurate in identifying fluid around the lung or pleural effusions when using ultrasound as compared to physical exam alone. So in short, the first question, is it relevant to teach medical students point-of-care ultrasound as medical students. In other words, a lot of people would say, well, why don't we wait till residency? My answer is, number one, if medical students are more accurate clinicians when using point-of-care ultrasound, then why would we not teach them as medical students? If we are able to graduate students who are more accurate when using a portable device that's been shown that we can teach them and is being used already worldwide, why would we not teach medical students point-of-care ultrasound? So that was the first question as to relevancy of teaching medical students. That's how I answer that question. The second question, the second thing you had to show was, I can't remember what my ordering was there, but I think it's how are we going to find time within the curriculum? The curriculum is already very full. And what we did is we tailored our curriculum to the new curriculum that was being implemented. We were somewhat lucky because there was a revamping of the curriculum in 2013. So our proposition to teach point-of-care ultrasound came at the time when McGill was renewing their curriculum. So our plan was to tailor our teaching to the teaching that was already being done. For example, all of our teaching is clinically based. In other words, we want to teach a medical student a skill, of an ultrasound skill, that can be used to answer a focused, discrete clinical question. One example might be, if a patient comes in with kidney injury, how could we use ultrasound in order to help assess that patient? So we proposed that if that's the skill we wanted to teach, then we would teach that during the block of time in which that medical student will be already learning kidney physiology, kidney anatomy, clinical skills, physical examination, history taking with regards to kidney, and then we would add to that package the skills with respect to point-of-care ultrasound and kidney injury. So it was very much dovetailed into the new curriculum, tailored to what was already being taught.
Okay.
So that was incorporating into the curriculum. As far as instructors, we ensured that we had enough point-of-care ultrasound instructors at McGill, and that was not difficult because point-of-care ultrasound is already standard of care in emergency medicine, and to some extent family medicine. So we were able, within the emergency department and family medicine, to find adequate instructors. And then lastly, as far as infrastructure, we pitched to our simulation center at the time that it was better to centralize teaching, and so they agreed that since we had a simulation center, that the teaching would be done there on standardized patients, and we were able to procure the funds to buy 8 machines through a benefactor who was approached with the whole proposition and who came up with the funds to purchase 8 machines, which are held at the Sim Center at all times. So all teaching is centralized at the Simulation Center. So those were the main challenges in terms of gaining the agreement.
What were the most important steps in developing a valid and relevant undergraduate PoCUS curriculum?
The 5 steps, 5 keys to success in establishing a PoCUS curriculum. Mm-hmm. First key to success is to master the literature on the topic. In other words, to know all of the relevant literature on who's teaching point-of-care ultrasound, how they're teaching point-of-care ultrasound, why they're teaching point-of-care ultrasound, whether point-of-care ultrasound teaching improves a medical student's accuracy, and whether there's any, and that's basically that. Also mastering the literature on the advantages of point-of-care ultrasound in terms of safety, ultrasound, the safety of ultrasound-guided procedures, and some studies which show improved patient outcome when point-of-care ultrasound is used in certain clinical settings, for example, the setting of trauma. So mastering the literature is number one, so that you know why you're teaching point-of-care ultrasound. There's a good reason, and the reason is that we want to improve, ultimately, patient care, and the way we can do that is by training more accurate and safe clinicians by using point-of-care ultrasound. So mastering the literature is number one. Number two is designing a curriculum that is tailored to the rest of the undergraduate curriculum, that is realistic, that is focused, that has clearly defined objectives, and for which the pre-course content, any evaluative techniques, any textbooks, any videos, all of those, the objectives that the students have to use, everything is aligned. So in other words, for our curriculum, what I did is I wrote a textbook tailored to our curriculum. Mm-hmm. And that textbook, from that textbook, the students read it before they come to the simulation center. They are sent objectives online, which come right out of the textbook. So they watch videos that come right out of the textbook, so that they arrive at the sim center having read the relevant material, having reviewed the objectives, and the objectives during the workshops or the hands-on workshops are aligned perfectly with the objectives. And in fact, they write a pre-test that is also aligned to the objectives. They write a post-test that is aligned to the objectives in the textbook. And then at the end of the year, they have an OSCE, or a practical evaluation, which also is aligned to the textbook objectives, videos, and pre and post-course tests. So everything's nice, it's very well contained. So I think designing your curriculum in a very, very focused, relevant, realistic way is key, because there's a great picture that I came across on the internet of a young child trying to take a sip of water out of an open fire hydrant that is gushing forth water. And that's kind of like the way I see the internet. You can go on the internet, you could find, a lot of people said, why are you writing a textbook? You can get information for free on the internet. And it's true. You could get oodles and oodles of information on point-of-care ultrasound on the internet through YouTube and many, many other ultrasound sites. And they're very good sites. Some of them are excellent. But it's hard to find information that is tailored to your clientele. So, for example, if you have a medical student with very, very limited time that they are going to be allocating towards ultrasound curriculum, you can't set them loose on the internet, because they won't know where to go, and they're going to be confused with the information. There's a lot of exciting information there, mm-hmm. but I don't think you're going to. It's going to be. It won't be constructive and measured, and you won't be sure that you're going to achieve the objectives of the course that is tailored to your current curriculum. So that's why I think designing a curriculum that is tailored to your current curriculum, designing your materials and your objectives and the evaluative techniques in a very aligned fashion is another key to success. Because without that, you won't be able to demonstrate that the students have acquired the skills that you set forth for them. Number three, a key to success is to evaluate your course. So I think you've got to evaluate in some way whether the students are actually, first of all, do they like the course? Secondly, do they have feedback that could improve the course? But more robustly, do they actually acquire the skills that you set forward for them? So we've published in the Journal of Ultrasound in Medicine an evaluation of our first-year course, which showed that the vast majority of our students, when evaluated by a certified instructor, did obtain the objectives of the course, did acquire the skills that we set forth for them when measured right after the course. And then we measured 8 months later and found that those same students were able to retain point-of-care ultrasound skills 8 months later. So I think it's important that you show that your course is effective. I think that's number 3. And number 4, key to success is to partner with, is to build a team. What's the word? To build a, what is it when you build a team of people that will ensure that it'll move forward in the future? I don't know what the right word is for that, but in other words, so what we did is we not only used a team of certified instructors, but we developed a near-peer teaching program. So what that means is that I approached interested residents and more recently students and offered them tutorials on how to teach point-of-care ultrasound. Why is that important? Because, well, number one, those instructors, and we did research on this as well, they improved their skills when teaching ultrasound, so it's an enriching experience for them. They're not only their ultrasound skills, but their teaching skills.
Sure.
And number two, when we looked at what the students' point of view, they felt that what they liked about having a near-peer teacher is that the near-peer teachers were more at their level, explained things in a very simple way, and also gave them confidence that if this student or resident could learn this material, that they also could learn the material. And they felt comfortable asking simple questions of the near-peer teaching students. So we have a robust program where we have near-peer teachers, and that's been very useful in terms of also just practically having adequate instructors for a course that really entails, for example, our course, we need 8 instructors every session. And if you think about how many hours of teaching we do a year, we need hundreds of instructors per year to teach our course. So a regenerative method of having instructors, because you will get instructor fatigue with such a large curriculum. Then also another key to success is ensuring an infrastructure. Ensuring an infrastructure, and to do that, you need to, you cannot be passive. You have to be proactive in seeking out the, what's the word, stakeholders or in the university community to convince them that providing an infrastructure is in the interests of enriching the curriculum. So we did that by proposing the course to not only the undergraduate curriculum, but also the simulation center, as well as a benefactor, and ultimately we were able to secure funds for the machines, and also for some the infrastructure in which to do the teaching at the simulation center.